Hi, Dr. Hamad from Allmed Medical Center and the Neuromedical Institute. Today we're going to talk about one of our patients. His name is Omar. Omar is a gentleman in his mid-60s. We saw him at Allmed Center about 5 years ago. He presented to us with severe lower back pain, radiating both lower extremities, numbness and tingling sensation down the lower extremities. The pain was so devastating to the point that he was not able to leave the house. He has tried several medications, including Lyrica, Tramadol, physical therapy, injections without any relief. Before he came to us, he did an MRI of the lumbar spine, which showed a large disc between the L5 and the S1, the final disc in the lower back. Based on his examination, his history, and that he failed conservative therapy, we recommended decompression therapy.
الحاج عمر صالح كنعان من مدينة بيت لحم. في شهر 12 عام 2014 صار عندي ألم شديد في منطقة ظهري والمنطقة اليمنى في رجلي. تعالجت عند عدة أطباء أخصائيين في محافظة بيت لحم ولا جدوى. الألم تم يعني يزيد ما يخف. كرر إلي عملية في الجمعية العربية ووقعت على المعاملة وكل شيء. وبطريق الصدفة في نفس الليلة شاهدت الدكتور مصطفى على برنامج صحتك في الدنيا، واتصلت على مستشفى الجمعية العربية وأجلت العملية، وقمت بالاتصال معاه مباشرة وحكيت له عن وضعي وعن المعاناة اللي عانيتها من الألم اللي كان من ظهري وإجري. فكان هو يستعد في إنشاء هذا المركز الطيب، وأخذ رقم تليفوني وقال لي يا حج أبو صالح خلال يومين بتم الاتصال معك وبخبرك وقتاش تيجي. وفعلا اليوم الثالث اتصل علي الساعة 9 الصبح، 8:30 9، وقال لي عمر كنعان. قلت له نعم. قال لي تفضل تقدر تيجي عندي على المركز. مسكني بيدي وكنت متألم جدا جدا، واخذني على قسم اللي فيه الأجهزة لعلاج ظهري. قال لي آخر شيء بنفكر فيه شيء اسمه عملية جراحية. هذه الأجهزة عشان نتخطى الجراحة.
Omar underwent 20 sessions of decompression therapy. When he first started coming to us, he was having significant hardship even getting to the office, since he traveled over an hour to get to us. By the end, he was feeling a lot better.
وسوى معي برنامج لازم أنا بلزمني أخذ كل أسبوع 5 جلسات متتالية، ممنوع أتخطى ولا جلسة، لمدة 20 جلسة. كل جلسة كان الوقت المحدد بالنسبة لي كان من 40-45 دقيقة. بلش معاي من أول جلسة قال لي أبو صالح ظاهرة طبيعية، الألم بزيد معك في بداية أول جلسات، من الجلسة الأولى والثانية والثالثة بزيد كثير معك الوجع. وفعلا اللي حكاه صار معي. بعديها ظليت مستمر. بعد الجلسة الخامسة شعرت إنه صار في تحسن والألم خف، وإني صرت أمشي على عجلي بصورة طبيعية. كنت دائما العصاية بإيدي أتركز عليها، ما أقدرش يعني إلا وتكون العصابية. بعد الجلسة الخامسة بالجلسة السادسة شلت العصا وصرت أروح وأجي في الممرات المركز. كيفوا الأطباء ودكتور مصطفى جزاه الله كل خير، انبسط جدا. كملت 20 جلسة، ومن هذاك اليوم لهذا اليوم بفضل الله ما رجعش علي لا ألم ولا أي حاجة ولا أخذت أي نوع دواء.
We wanted to follow up with Omar and to see how he's doing 5 years later. So not surprisingly, we found him to be doing extremely well, almost pain-free, living his normal life, without any pain. We repeated the MRI of the lumbar spine, which showed almost total resolution of his disc 5 years later.
أنا النصيحة بعد تجربة مريت فيها أنا عمر كنعان إني بحبذ كل إنسان بيعاني من هذه الآلام وخاصة فقرات الظهر والركبة، بحيث إنه علاجه متوفر في هذا المركز بدون عمليات جراحية. والتجربة اللي أنا مريت فيها أكبر دليل بفضل الله، والفضل لله ثم للدكتور مصطفى والطاقم الطبي في هذا المركز والممرضات، عاملوني في معاملة حسنة جدا جدا.
Decompression therapy is a treatment modality. We use a specific machines or devices. In our institutions, we used the DRX 9000 and 9000C. The idea behind it is the patient will wear a harness and he becomes part of the table or part of the device itself. So then the device will be programmed to angle at the level of the disc that we are interested to treat, if it is in the cervical, thoracic, or lumbar spine. So it angles where it starts pulling, and the pull is focused on the disc that we want to treat. The pull itself will create a negative pressure within the disc and between the two vertebrae that we want to treat. The negative pressure creates two phenomena. The first one is a suction phenomena, where the disc starts sucking off the nerve and away from it. If the disc is off the nerve, then the pain is gone. The second phenomena, it creates what's called osmosis in chemistry. Osmosis is essentially when there is a negative pressure within a chamber or a compartment, and here we're talking about a disc, the nutrients and fluid will seep from the higher pressure outside the disc into the negative pressure which is inside the disc. So the disc becomes healthier and in better shape. So the treatment requires 20 sessions. Each session is 40 minutes and we spend about 15 minutes using a TENS unit or electricity with heat to relax the muscles after the pull. After 20 sessions, we expect significant relief of the pain and the symptoms that can include numbness, tingling, or even weakness in the lower extremities. We have been following our patients since we're conducting a study about decompression, and we have done an MRI before and an MRI after. Currently we have over 492 patients. We have demonstrated significant clinical improvement that exceeded 80% clinical improvement, and significant radiologic improvement with improvement in the disc height, the disc morphology, the disc signal, the neuroforamina, and how far the disc got away from the nerve root. There is a misconception about that comparing decompression to traction, and there are totally two different modalities that have actually been compared to each other and shown the difference between the two. So in traction, and which is essentially what patients receive in physical therapy, the entire spine is pulled in that direction. So that pull, two things happen. First, the power or the force is distributed throughout the entire spine. So the intended treated disc will get very minimum of this force, versus the decompression, the pull is at an angle where the entire force is focused on that disc that we want to treat. Now, the second thing, the traction, when you pull in that direction as a reflex and to protect the spine, the muscles of the spine will pull in the opposite direction, and this is a reflex. That pull in the opposite direction can result into muscle spasm, where the patient might suffer from worsening of the back pain, and at the same time the benefit might not last for a longer time. So there's a huge difference between traction and decompression that I wanted to clarify. This is a non-invasive procedure that is extremely effective in treating spine disc disease if it is in the lumbar, cervical, or thoracic area, and I highly recommend it for a lot of our patients that qualify for it. Of course, not everybody qualifies for this therapy. To qualify, you have to have the lower or neck or mid-back pain caused from a disc disease that can be bulging. At times, if herniated, can also qualify as long as there's no cord compression. And also, however, patients who have a compression fracture, osteoporosis, a fusion of the spine might not qualify for this therapy. So prior to putting any patient in decompression therapy, we evaluate them, take the history, do the physical and neurologic examination, and we do an MRI imaging of the area to demonstrate specifically how the disc is affected and how it's affecting the nerve root prior to committing the patient to this therapy. And thank you.